Welcome to Conversations with your host, Ron Bryant, who will engage in lively and informative dialogue with politicians, leaders, visiting celebrities, and individuals making a difference in the community fabric of Central Ohio.
On this episode of Conversations, I sit down with Matt Habash, Executive Director of the Mid-Ohio Food Bank. We'll discuss the work and services of Central Ohio's lifeline for thousands of families and their fight against hunger. Here's my conversation with Matt at the Mid-Ohio Food Bank corporate offices. So Matt, tell us, what is the state of availability of food as it relates to hunger in Central Ohio?
Well, we're blessed to have a community where people don't want to see anybody go hungry. So the unique thing is we have over 600 partners across the Central and Eastern Ohio region that are willing partners of ours to distribute food to folks. And we've been working really hard to grow. I started in 1984 and we gave out 3 million pounds of food. This past year was 54 million pounds of food.
Fantastic.
So we're finding a lot of food.
That's wonderful. So the food bank has been in operation since 80. You took it over in 84. What has the growth been like since then?
Well, I often say I have a growth pattern that most profit-making companies would like to have because it's been a straight shot with serving more people, finding more food, but the reality of it is that serving more people is a serious issue in terms of hunger in our community. When you realize that 1 in 4 children are hungry, that we're continuing to see huge numbers of people, we're continuing to see people where half of them are working. Somebody in the household's working and yet they're using a food pantry. That's a huge shift in the years I've been around.
And you're working with Feeding America. How's that working out?
It's been a wonderful network. There's 200 food banks around the country. We have about a 20 county service area, so we're best known for what we do right here in Columbus. But the reality of it is we partner with all the other food banks to really try to address hunger across the entire United States, to work with national manufacturers to acquire food, to work on food safety standards, to work on lobbying, advocacy work with the federal government and the key role that they play. And then we do that also in Ohio with the 12 food banks in Ohio, working with the Ohio Association of Food Banks to trust state government.
Okay, wonderful, wonderful. Now, where does a food bank get their food? I'm sure you probably work with farmers and in industry, corporate, but where do you essentially get that food?
Most of the food at a food bank is surplus food that's come from the excess of the food industry. And for many, many years, that was what we think is dry packaged goods. I often used to say, every time there was a new cartoon character, they made a new cereal. We would have, every time there's new health craze, something would happen and they'd overproduce, we'd end up with a lot of it. A lot of that's gone away. Often, say now, we've all got keychains with little tags on it and the retailers know and the manufacturers know exactly what we bought when we bought it. So there's been a shift in the last 3 to 4 years to fresh food. And that's really been the neat thing that we're doing now is giving out fresh produce that comes from all over the country and retail products from our partners in the retail industry.
Now, when you say fresh food, that's perishable food?
Mm-hmm. When you think about it, the estimate is as high as 14 billion with a B pounds of produce are left in the fields and not harvested in any given year. Nationally, the Feeding America network of food banks has moved from 350 million pounds in 2011 to 1.3 million pounds of food, of produce. So we've got a long upside. We can go and getting more fresh food to people. We know from our clients that we survey, because we've gone from 0 a few years ago to over 600 produce markets where we give out fresh produce in a community, usually twice a month, so that about 200 people show up at a time. It's about 10,000 pounds of produce. But when you think about connecting people, from talking to them, they're saying the one reason they do not consume more fresh fruits and vegetables at the grocery store is they can't afford it. It's
can't afford it. My. So you're filling the gap for sure.
Absolutely, and I think we're also extending. So for us, it was always about just addressing the hunger problem in the past, and the new strategic plan is really about ending the line. We talk about feeding the line, so everybody that shows up, can we feed them? And we've got a plan to continue to grow because there's so much fresh food.
Yes.
But we also want to talk about ending it. What does that look like? And can we have an impact on their health? So we were one of 3 food banks that did diabetes research.
Okay.
And so, and the model that we used, we partnered with the Columbus Neighborhood Health Centers, and we partnered with the Central Ohio Diabetes Association, and then we dealt with the food insecurity, because the question was, can you manage diabetes if you're food insecure? And very difficult, if you don't have the right foods.
You're right.
So we came in and said, we will deal with the food insecurity issue. We will provide diabetic-friendly foods, and we will study the impact. Our model was such that we had a significant impact and statistically valid impact on reducing what they call the A1C of diabetes, reducing that So we're excited about that. We now say food is health, and we're beginning to
wonderful.
build connections to the doctors who didn't screen for food insecurity, and to really say, look, we can have an impact on people's health. Think we can help bend the cost curve of diabetes and hypertension, and address some of the obesity challenges.
That is so good. So the community need for quality food is very paramount, and you're covering that.
We're working hard at it, and the beauty of it is it's still our core business. It was surplus food, it's leftover. We've partnered, via the state of Ohio with the Ohio farmers to capture the surplus food in Ohio throughout the entire state and get that food to hungry people. But it also means we've got to change our model. Our model was a 3-day supply of food come at the end of the month when you ran out of food. And it's been that way forever, some version of that at our pantries. And so we're using our pantry downstairs as an experiment to say, come every week. We want to give you fresh fruits and vegetables. We want to give you fresh bread.
Yes.
If we have meat and those kind of products, the kind of things that we're picking up from our retail store partners, get it. Because that's the way you and I would go buy groceries. We don't buy milk once a month or it wouldn't taste very good, towards the end. Our produce, somebody called it around here the crisper of good intentions. You put too much in there and life gets in the way and you don't use it. So we want to get it to people in a just-in-time kind of method, which means we got to rethink the entire logistics of how we do our work.
And talking about rethinking that, the need for quality food for families and fighting child hunger, I know that's probably very high on your plate as well.
Very much so. When you think about, what I'm suggesting is we got to go upstream and we've got to think a little differently. So we've been partnering with United Way and some other folks to really talk about the second half.
Children's Hunger Alliance.
Children's Hunger Alliance, the Shelter Board, Goodwill, the nonprofits, and the business community, as well as government, all coming together and saying, what would it look like to co-create a sustainable community where everyone thrives?
Yes.
We put that into our mission. It's a lot different than just feeding people.
Absolutely.
And saying, what do we need to do? So if we want to improve kids' education, we've got to make sure they're eating healthy.
That's right.
So
that first meal is so important.
It is. Infant mortality issue has a lot to do with poverty and what the moms are getting in terms of nourishment. So how do we help in that arena? I'm even suggesting, I tell every business group that meets here, somebody in your outfit, your organization's probably using a food pantry because we're helping over 500,000 people in the 20 counties, independent, unduplicated number of people annually. And a lot of those people are working. And they're not going to be very productive workers if they're worried about feeding their family. And so we're suggesting that, even on workforce development and workforce improvements, it has an issue. Clearly has an issue in the health, as we're already really learning. And we believe can have a huge impact in education. If a kid's ready to learn because they're eating good, healthy, nourishing food, it's a lot different than going to school. Particularly if you're not in the school breakfast program or something, you may not eat till lunchtime. And if you didn't get anything over the weekend, so we have a backpack program to help families over the weekend. You're not thinking about holistically. So what we're suggesting is let's take a holistic look at what we're doing from a person's perspective, or what we call client-centric kind of thinking, as opposed to we're just about providing food.
Since the Affordable Care Act was signed into law in 2010, 28 states plus DC have expanded Medicaid, and millions have gained coverage through Medicaid or CHIP. Millions of young adults have gained coverage through their parents' plan. Americans saved $9 billion because insurance companies must spend at least 80 cents of every premium dollar on health care. 9.4 million seniors and people with disabilities saved more than $15 billion on prescription drugs. Nearly $1,600 per beneficiary. Nearly 11.7 million Americans are signed up for coverage through the health insurance marketplace. The ACA has helped achieve an historic reduction in the uninsured. To date, 16.4 million uninsured people have gained health care coverage. The Affordable Care Act. 5 years of providing access to affordable, quality health coverage.
Now, a little earlier we were talking about when we first came in, you also have a farm. And you're doing some farming to bring in your own food as well as getting food from all the sources that you get. Talk about that farm.
Well, one of the unique opportunities we had was a donor who came and said that they wanted to talk about could we see if urban farming, different than community gardening, because urban farming work in Columbus, Ohio. And it resonated with us because one of the key questions when we moved into this space 5 years ago was, how does a community feed itself? And so we began to look at, and we were lucky enough to partner with the Columbus School Board, who had a site over in the Marion Franklin area and gave us a 5-acre site attached to Clearfield Elementary School. Had a fabulous, fabulous partnership with the Marion Franklin community. You know, the community association there came together and embraced this. It was the best community engagement project we could have ever thought of. So we grew a little bit of food a year ago, and they all got involved, and they helped us do all of that. The high school team from Marion Franklin High School came and pounded all the stakes in for the tomatoes. They got real involved. So it was the best thing was really the community engagement. So part of it is designed to help feed people. So they get and to teach people where food comes from, particularly young people, growing it right in your backyard, and then moving from that to selling a little bit of that to restaurants, and to look at how we can, the next thing we'll want to experiment with is, can we sell it at a low cost model? So they started for us a pay if you can farmer's market right there. So it was a really unique way of just starting, and the amazing thing is the farmers that are my farm managers are all women.
That's remarkable.
And the community has embraced it.
My goodness, Matt.
The next step is we're working with the city's land bank to go to up on the hilltop, up by the health center there. There's about a 5-acre site. We're currently negotiating about doing something on the hilltop, hopefully in partnership with that community.
Remarkable. I applaud you guys. Food distribution. Now, I know you have the pantry setups and, you know, the other outreach that you have. If I wanted to just call and drive up and say we need some food, how does that work? How does that distribution process work?
There are a couple different ways to do it. One of is you can go to Hunger Hub, which is a website online, and find out where the closest pantry is to walk in your community. So that would give you an identification there from a walk-in perspective. Or you could call Hands On, you know, Central Ohio 211.
Hands On Central Ohio.
If you call them, they'll refer you to a pantry close to your neighborhood. So either one of those two, you know, some of the agencies use Hands On as their referral and scheduling source, so you have to go through 211 to do that particular agency. Others just take walk-ins in the neighborhood. So it's a couple different ways. We're trying to make it as easy as possible. And then in addition to the food pantries, we're also are up to over 600. I think our goal this year is to go to 900 produce markets. We want to make them right in communities on regular days so that people can access produce, you know, a couple times a month right in
That works hand in hand with the urban farming project.
Exactly, and it works hand in hand with the fact that, you know, we're bringing produce in from all over the country, and it's the most economic and the best use, efficient use of somebody's donation to us. We can bring produce in for our average right now is 17 cents a pound, fresh from the farms in California. And so that's a lot more sense than us going out in the marketplace and buying canned goods at 60 cents a pound. So we're, you know, using the donated dollar, we're bringing in fresh food, and it's food people can't afford.
There's a term that's being bounced around now called food resilience. The White House has its Council on Environmental Quality, and one of the tenets of it is food resilience. Just talk about that future of food as it's related to climate and environmental issues.
Well, I think it's going to become real important. I mean, I was just in California, and the droughts out there right now scared me to death. California looked like Arizona to me. It was brown, burned out, and I'm like, and they tell me half the food in the United States is produced in California, so we need to be real careful. You know, we really need to think about, you know, the difference, because people confuse. They see a bunch of corn in Ohio and think that's all going for food. That's actually a commodity, you know, going for other purposes. Right. And so we need to be real mindful. That's why questions like how do communities feed themselves are really important questions, really understanding where your food comes from, how far it's coming from, what you can do to grow more food yourself. So, you know, even teaching people how to grow food in those little plastic swimming pools. You can grow a lot of your own food. You know, the wonderful churches that teach canning, you know, how to can your, there's all kinds of things that you need to think about. And they don't have to be large scale, but things that are large scale. The Wyland Park Food District is a wonderful project in this community that we're trying to say, can we have an economic engine for the Wyland Park area around food and producing food, taking some of our food and extending the life of it, repackaging it. So we're talking to Abbott, we're talking to Ohio State's, you know, all of those people coming together. Coalescence, which is a wonderful, you know, company in this town that does mixing work, who are graduates of Eastmore High School and graduates of Ohio State University, saying, how do we all come together and what can we do? You know, I'm concerned about the cost of protein. You know, hamburgers closing in on $5 a pound, and the futures will say it's going to continue to go up. Can we create a protein pack that I can put on top of vegetables as a seasoning pack?
Bison burgers.
Anything we got to start thinking a little differently. We've got to start really, and it all comes from an understanding about food. You got to pay, our biggest learning out of our diabetes research wasn't the diabetes. It was that doctors, primary care docs don't screen for food insecurity. Or that 60% of the people we were helping were suffering from depression, not knowing where their next meal's coming from. We can help with other issues. We've got to understand the impact food has on our lives, and we sometimes take it for granted. We have in America taken food for granted for a long time.
The city just, along with the county, put together food preparedness and a program in place. Are you guys working with them in any form?
We're going to be part of the project in terms of really understanding so that they understand the size and scale of what we're doing. What's real helpful, with our conversation is getting people to understand how food banking has evolved, and that we have this ability to bring a lot of fresh food and healthy food to the community in a just-in-time manner. And so looking at food plans, looking at, our learning was, from people was they can get to the grocery store, the cost of food is an issue. So we've got to address, the cost of food in a community and look for ways. We've got to address living wage issues and issues for people. And those are conversations that are difficult to have, but we've got to start to have those kind of conversations if we want to build a community where everyone's thriving.
With that word, let's hear from County Commissioner Paula Brooks real quick.
More than 1 million Americans are living with HIV, but nearly 2/3 do not get the care they need to stay healthy. And transmissions from those not getting care account for 9 in 10 new HIV infections. Diagnosis and care can improve the lives of people with HIV and reduce the likelihood of transmitting the virus to others. 100 people who don't know they have HIV transmit the virus to nearly 7 new people each year. But that rate drops rapidly as people go through care. Every year, 100 people who have HIV under control through medication infect less than 1. But today, just 30% have the virus under control, and 50,000 people become newly infected each year. Improving the health of people living with HIV today could prevent the vast majority of new infections tomorrow.
Paula, you've been doing some wonderful things as County Commissioner, and you've been elevated to the White House Council on Environmental Quality. Just talk about that, because you've been doing that for just about a year now.
For the last year, I've been serving on the White House Task Force on Climate Preparedness and Resilience. And we've been very hard at work. It's a bipartisan group of 26 elected officials from around the country, governors, mayors, county commissioners, and tribal leaders. And the president asked us to, in particular, look at issues related to climate impacts and how we can be resilient from and better prepared for those climate impacts.
We've been here talking to Matt Habash at the Mid-Ohio Food Bank, and there are wonderful things that they're doing. You've got some things that you've got to do as it relates to that commission, that council. Just talk about that real quick.
We're very concerned about food security. And as we've been briefed by the White House science advisor, by the experts in the federal government, and also had many conversations with the private sector, we've come to learn that climate impacts will mean that there will be more droughts in certain parts of the United States, and in our case, more inundations, those hard, fast rains that we seem to be getting more and more of.
Right, like in California.
Exactly,
recently, yeah.
Yes, and they will impact our crop yields. They also, just as a paycheck issue, which we discussed when we met with the president recently, the cost of such things as the hamburger on your table is going to go up. Because the drought is hitting areas where beef cattle
That's what Matt was saying.
Where beef cattle are generally raised and then brought to market. And in addition to that, a really scary thing that I heard about when I was in Toledo just before the water emergency hit up there was that many of the plant scientists, and I also heard this at Central State from other biologists there, the crop yields we expect are really going to change. So what does that mean for the average person? Again, it means that if those crop yields are going to be down, that means less food. And we know, especially here at the Mid-Ohio Food Bank, what that means. That means more hunger. We also know that those crop yields, even when they are up, are going to be reduced in their nutritive value. What does that mean? That means that we're going to need more because the nutrition that we get through corn and soybeans and all those things that they go into, it's throughout our food chain, will not be as good for you or provide you as many positive calories as you need. So all these changes are coming, and you know, it's such a gradual thing that people say, oh, we don't have to worry about it. We have to act on climate now. We cannot wait until this big change just suddenly hits us.
There's a catchword that's going around that's coming off of this White House piece, resilience.
Absolutely.
And we're talking about food resilience. What's that all about?
We're beginning to try to understand how we can bounce back from these things. And food resilience is one whole area where we know we have to sustain ourselves. And resilience in kind of a biological sense is the ability of species, people,
Yes.
or crop species, to take those hits that might come from climate impacts.
And then bounce back.
And bounce back,
Yeah.
Exactly. So you're going to hear more and more about resilience and how we can, as humans, as a community, and as food supply, be more resilient. That's going to mean that we have to take that good science knowledge that we have out there and use it wisely so that we can be prepared again for these climate impacts and be resilient from them.
Now, Central Ohio, your office, and the city of Columbus, of course, have stepped forward with a partnership. Talk about that partnership.
We're very excited here in Central Ohio to lead the way, and I'm particularly proud as a task force member on the White House side to see us perhaps be the first in the nation as a city, county, and regional effort to map out our food chain. And, you know, you need to know what you're doing now.
True.
In order to figure out where you're going in the future. And that's what this project will allow us to do. I hope that the public sector, meaning the city and the county, will join with the private sector, our restaurants, our grocers, and our great nonprofit groups like the Mid-Ohio Food Bank. We need everybody at the same table.
Yes.
So that we can all make certain that we're prepared for, and again, as you know, resilient from those climate impacts. It's kind of hard sometimes to grasp what these climate impacts mean, but we know that we've had here in Central Ohio and Ohio, as a Great Lakes state, a 37% increase since 1958 in those hard, fast rains called inundations. Those are washing our topsoil away. It certainly is causing the flooding problems that we're
Yes.
seeing more and more.
Yes.
But also that's impacting how farmers have to plant their crops and when.
Rotate them.
We're starting to hear more debate about no-till. It somewhat relates to that. And in addition to that, we're seeing the drought in other parts of the country where we've traditionally relied on to get a lot of our wheat, our livestock.
Okay.
So we've got to be prepared for and understand that better. Now, the good news is we've got some new tools. I was at the White House just 3 weeks ago now with Vice President Biden, And this is such an important issue that the National Security Council was there with us, and they helped our task force put together new tools on food security. So now our group that will be doing planning for the City of Columbus, for Franklin County and the entire region, will be able to take advantage of those tools that have been tested by the National Security Council, and they'll be very precise in how we can measure, okay, what are the impacts we can expect? Okay, well then let's factor that in to our food plan.
Okay. I guess we're going to be rolling this out statewide as well?
I certainly hope so. I hope we'll be rolling it out nationally at the end of the day.
Excellent. Well, we want to thank you so very much for this opportunity, and we'll check back in the near future to see how things are moving forward.
I look forward to that. We need everybody at the table.
Thank you.
You're welcome. Thank you, Ron.
I'm only 17, but I know about investing. Believe in something, buy shares in it, watch it grow. So, what if you could invest in the future? The future of kids, like a stock. Not the kind of stock that's about making money, but a stock for social change. A whole new kind of investment called Better Futures. When you invest, it helps kids go to college. I could be one of the first college graduates from my family, the first philanthropist from my neighborhood. And if I'm the first, then maybe there's a second and a third. Believe in us, invest in us, watch us grow. My name is Sydney, and I'm your dividend.
Matt, no one should go hungry, yet thousands of people go hungry in our community every day, and the Mid-Ohio Food Bank is fighting that. Talk about it.
Well, I mean, when you realize we take for granted, and I often say hunger is hidden, one of the things that we've created is a data tracking system. So used to be, we had no way of knowing, I could tell you where people that were hungry picked up food at a distribution site, but I didn't know where they lived, and now I can tell you pretty much as we build out this system that I've got hunger throughout the suburbs, I've got hunger on streets in German Village, I've got hunger in places you'd never think about. So we're learning about that. We're also learning about how often people use. The amazing statistic in that data set is that 80% of the people are coming 5 times or less a year. We have this idea that people get free food and they come back. Majority of people are very episodic in their hunger. Yet on the other end of the spectrum, people that are coming a lot, if they're a senior citizen, we're going to feed them the rest of their lives. There's nothing in their system that, an increase in Social Security or something that's going to help them. So we want to take a very client-centered approach to our work. And what matters to the client, how can we help you, what help do you need, and then what other help can we also use food as the investment to gather other resources from the tremendous work being done by other organizations in this community to come together and focus on holistically what our clients need.
And part of your core values, innovative learning, that's one of the tenets as well?
Absolutely. Yeah. I mean, one of the things we continue to do, so we're at the forefront of creating that database. There isn't another one like it in the country, so we can really learn from that.
Truly innovative.
Reeb School, we got invited very late. It's a wonderful project that the mayor's led. The city's really, come together with the county, with the state, with a lot of other nonprofit organizations. We got asked to, to deal with the food issues in that, and it's very late in the process, so we've been retooling it a little bit. We're going to run a kitchen that will feed Southside Learning Center's, daycare 2 shifts. Boys and Girls Club have an after-school meal program in there. We want, instead of creating a soup kitchen and a food pantry, we want to create a market and a cafe. So if you think about, and some people may be familiar with Panera Cares, where you pay if you can at certain Paneras in the country.
I applaud that. Wonderful.
Bon Jovi's got Soul Cafe in New York. So you and I could go eat lunch there. We would pay what we can. We could pay ahead for somebody else. It replaces a soup kitchen. We treat people with dignity. We can teach skills. And we have a small market in there where we sell very, very low-cost produce so that people can get access to help. We don't need a big grocery store, and Kroger's around the corner. But we need to be able to connect people, and that's what we really want to do.
Truly innovative.
And there's a federally qualified health center there, so can we partner and share databases and really look at health strategies for people that are coming to the health center? And there's 55 independent housing units for seniors being built. How do we involve them in the program and make it their coffee shop. So that's the kind of innovation that we want to play with on the South Side and make it a really unique space for people to come and gather.
Matt, we want to thank you so very much for having us here. It's a wonderful conversation.
Thanks, Ron.
Thank you.